each other lies. We're one, but we're not the same. We get to carry each other.
Hello, welcome Jan to our Chit-Chat Cafe. Great to talk to you. Can I just ask you first of all to perhaps just say a little bit about your own situation and where you're from and so on?
Sure. So my name's Jan and I live in the north of Hampshire. I'm a mum I have five kids. My youngest daughter, who is 29, has enduring and complex mental health issues, which I've learnt so much from over the past 8 years. It's quite a journey.
Yeah. Okay. How would you describe the biggest kind of challenge that you've experienced over the past 8 years?
Well, there's so many, really. I mean, there's an element of shock and fear, and what on earth is happening to your child. There's a feeling of real grief and sadness, and then at other times little spaces where life becomes so enlightening, when she has taught me so much. But some of the biggest challenges have been that feeling of sort of isolation. Does anybody else really get what this feels like? And does anybody else have any information that could help me do things slightly differently? Or who else is going through this?
Right.
'Cause services, they don't always feel very flexible, and staff within services are very, very busy and don't always have the time to give to you when you have a million questions you want to ask. That has been incredibly difficult, and dealing with really high risk has been really hard.
Okay. And how have you found in your role as mum, carer, support worker, whatever? I mean, have you found that you've been involved by mental health services and so on? How's that experience been?
Yeah, that's felt very different at different times along the way. In the very beginning, we had an early intervention service that supported us, early intervention for psychosis team, who worked very differently from the other teams we've since been involved with. The EIP team worked very much with families, in our experience anyway. So I was actively encouraged to phone in if I had questions, if I was worried, if I thought things were changing. So I felt like a collaborative partner, which, throughout all of that fear and grief and confusion, at least helped us all, I think, feel safer. They do take note of family systems, because, like people say all the time, we don't live in isolation. Usually we live in family systems. So that felt helpful, right, and recognised. In other teams, both inpatient and community teams, I've not felt that. I've felt a lot of barriers at times, and I've almost felt a nuisance at times for wanting to phone in, and because people don't have time.
Okay, that must feel really difficult.
It's horrible. Now, there are really wonderful individuals out there, and I have found some people who I can reach out to within different service teams. So I don't want to say that there's no one, but I would say the systems and the processes don't really allow for much information sharing and collaboration about, you know, kind of care planning together, which is such a shame. I know there's a lot of work going on to change that, and I know the triangle of care is something that's really being promoted within our health authority.
Okay.
And that is specifically to involve more carers, families and friends, to work alongside and in partnership with professionals. So that feels good. There's a lot to change, but there is a will to change it.
That's brilliant. Thank you. What would you say has been the most helpful for you on this journey you've been on?
One of the most helpful things has been the carers support network that's been really strengthened up since the COVID pandemic started, because the Zoom groups that have been weekly carers groups have enabled us to meet each other from all across the county. We have supported each other in times of, you know, wellness and illness and all things in between. You know, we share information. So if anybody's got a helpful link or knows about something that's going on in their community, we try and share it. And I think all of us would say it's been a lifesaver to have that connection with each other and to find out, you know, where things are happening and will they be helpful to us. We've shared e-learning courses with each other. Yeah, that's been one of the most helpful things. And the other thing outside of the carers network is trying to find good communicators within the service teams. So if you can find yourselves those people who will give that little bit more time, maybe a consultant, maybe a primary nurse, maybe a support worker or a peer worker, I actively seek out those those good communicators too. Brilliant.
Okay, that's great. So the carers network that you're talking about, is that who's kind of running that? Is that something that other people can access?
It's been a Southern Health initiative. I mean, I'm sure there are carers groups all over the country. Different health trusts are running.
Yeah.
At the moment, there's two that I go to. There's a Mid and North Hampshire group that is for people who live in Mid and North Hants. That meets the second Wednesday of every month. And there's a weekly Friday morning Zoom group, which has been a group that it started during the COVID lockdown. Yeah, that's for people all over the county. Okay.
And I think you're right, wherever people live, there are different sort of local groups. There's work there, so it's finding out what's
I think so. I think it's really important to find out what's going on in your community. Are there Zoom groups? Are there physical carer spaces, you know, for carers, families and friends? It's been a lifesaver. And I know that, you know, all over the country there will be different groups. Some of them will be big groups via national organisations like Carers Together and Carers UK, and others will be, you know, specific maybe to, for me it was important to be part of a specific group for mental health.
Yes.
So, you know, I did my research and I found I'd really encourage people to try and do that.
Okay. That's brilliant. Thank you so much, Jan, for joining us today, and look forward to talking to you again soon.
You're welcome. Yeah, many thanks.